So we're going to be looking at another topic today. So in the last video we treated one of the musculoskeletal disorders, genetic disorders known as muscular dystrophy. We looked at the overview, the background. So today we're going to be looking at a new topic, and we're going to be looking at spinal muscular atrophy. So spinal muscular atrophy, it is basically a genetic neuromuscular disorder, and it affects motor neurons in the spinal cord, and this leads to progressive muscle weakness and atrophy. So the motor neurons, they are nerve cells that are generally responsible for controlling voluntary muscle movements. So voluntary muscle movements like walking, swallowing, breathing. So these are basically what these motor neurons are responsible for. So this condition, it primarily affects infants and children, but some forms may develop in adolescence or adulthood. So the severity varies, with some cases causing early childhood mortality, while other cases they allow for a near to normal lifespan and with disabilities. So there's no, just like muscular dystrophy, there is no complete cure for this spinal muscular atrophy, but there are advancements in gene therapy and supportive care that can significantly help to improve the survival and quality of the life of the patient. So when we're looking at the background of this spinal muscular atrophy, it was first identified in the 19th century, just like muscular dystrophy, and its genetic cause was actually discovered in the late 20th century. So it is one of the most common genetic causes of death in infants and young children, and the disease is caused by a mutation in the survival motor neuron 1 gene. So this leads to loss of motor neuron function and muscle degeneration. So scientific advancements have led to the development of targeted therapies that alter the disease progression, particularly when treatment is initiated in early life, like at the infant stage. So looking at the types of this spinal muscular atrophy, there are several types, and they are based on the age of onset and based on the severity too. So we have spinal muscular atrophy type 1, which is also known as Wedning-Hoffmann disease. So this is the most severe and common form. The way we had Duchenne muscular dystrophy in the last videos, which was the most common form of that particular disorder, while here this Wedning-Hoffmann disease is actually the most common form, also known as spinal muscular atrophy type 1, and it is the most severe form, and it usually appears before 6 months of age. So before a child is 6 months, it usually appears, and affected infants, they never achieve the ability to sit independently, which is usually one of the first things that infants do. Like they try to sit up, learn how to sit up. So most of these affected infants, they never get the ability to learn how to do this action, and then we'll see severe muscle weakness, see difficulty swallowing, and respiratory failure too, which can occur early. So without treatment, the survival period beyond 2 years of age is very rare. So if we don't give proper treatment for this particular type, the survival period is very limited. So we also have another type known as spinal muscular atrophy type 2, and this is the intermediate form. So here symptoms appear between 6 and 18 months of age. So it appears when the child is between 6 and 18 months, and children can usually sit in this type. They can be able to sit up, but they cannot stand or walk independently. So progressive weakness usually leads to respiratory complications, and many individuals, they survive into adulthood when given appropriate medical care. So unlike the first type, here the child is able to sit but cannot stand or walk, and it usually occurs, instead of before 6 months, it usually occurs between 6 to 18 months of life of the child. So and the survival rate is a bit higher compared to the type 1. So looking at spinal muscular atrophy type 3, which is also known as Kugelberg-Wellander disease, it is milder. It is the milder form, and it usually has the onset in childhood or adolescence. So individuals, they can walk independently, but the muscle weakness gradually leads to mobility issues. So life expectancy here is near to normal when given proper management. So this form is typically milder than the first two types. Then looking at the last type, that is spinal muscular atrophy type 4, which is the adult onset form. It is rare and is the mildest form, and it develops in early adulthood. So symptoms include slowly progressive muscular weakness, mainly affecting the legs, and individuals, they usually maintain functional independence throughout life. So those are the those are the 4 common types, and basically the most severe form is the type 1. So looking at the signs and symptoms, they vary based on the age of onset and the disease severity, similar with muscular dystrophy. But some of the common features, like for example, if we're looking at the early symptoms, muscle weakness, often starting in the legs and spreading to the arms. Then delayed motor development, like I said before, difficulty sitting, walking, standing. Then floppy or weak muscle tone, known as hypotonia, especially in infants. Then when we're looking at the progressive symptoms, like loss of previously acquired motor skills, like such as the ability to sit or stand, like something that you were able to do before, all of a sudden you won't be able to do it again. Then difficulty swallowing and speaking, which usually leads to feeding challenges. Then breathing difficulties, including weak cough and risk of infections. Then when we're looking at the severe symptoms, we have joint contractures, which is joint stiffness, and this can lead to deformities. Then we have followed by the spinal deformities like scoliosis due to weak back muscles. Then respiratory failure, which may require ventilatory support. So those are the breakdown of the symptoms. They're looking at the clinical presentation. So the clinical presentation always depends on the severity and type of this spinal muscular atrophy. So in infants, the condition presents as weakness, poor muscle tone, difficulty feeding, and respiratory distress. Then in children, the symptoms include progressive loss of mobility, difficulty swallowing, and skeletal deformities. Then looking at adults, the disease progresses slowly, mainly causing muscle weakness and fatigue. So it's just the clinical presentation is quite common for the different ages. That the peculiar thing that is most commonly seen is muscle weakness and having difficulty in mobility. Then looking at the etiology, so this spinal muscular atrophy, it is caused by a mutation in the survival motor neuron 1 gene, which is located on chromosome 5. So this gene is responsible for producing the survival motor neuron protein, and this protein, it is essential for survival and function of the motor neurons in the spinal cord. So this particular protein is very important, and without this protein, the motor neurons, they gradually degenerate, leading to progressive muscle weakness and atrophy. So the breakdown is that there's a mutation in a gene, survival motor neuron gene, which is responsible for producing this particular protein, survival motor neuron protein, that is essential for motor neurons to perform their function. So without this gene, motor neurons cannot get the proteins, and without the proteins, they cannot perform their function. And this is where without them being able to perform their function, we'll see muscle weakness and basically the other symptoms that follow. So looking at the risk factors, genetic inheritance is one of them, and it is usually inherited in like an autosomal recessive pattern, which means that both parents, they must carry the mutated gene for it to be passed down. Then having a family history of this spinal muscular atrophy too is a risk factor. And then lack of early treatment, which worsens the situation and can worsen the disease progression. So looking at the anatomy and the physiology, the spinal cord contains motor neurons, which control voluntary muscle movements. The motor neurons send signals from the brain to the muscle to initiate movement. So in this spinal muscular atrophy, loss of motor neurons leads to muscle atrophy. So if these motor neutrons are not getting the protein that they need to carry out this movement cannot be carried out. So that is basically how this defect occurs. They cannot send the signals that is needed to be sent to the brain for the muscle to work. So there's loss of function, a lot of things are going wrong because they are not getting the food they need, the protein that they need. So that's basically about the physiology of it all. So breaking it further down using the pathophysiology. So there's a genetic mutation in the survival motor neuron 1 gene, and this results in insufficient survival motor neuron protein, the protein that these motor neurons need. So these motor neurons in the spinal cord, they begin to degenerate as they are not getting the food that they need to perform their function. And due to them not getting this protein, muscle fibers, they lose their connection to the nervous system because these motor neurons cannot send signals to the brain, and then this leads to muscle wasting. So progressive loss of voluntary movement occurs, and mobility is affected, swallowing is affected, basically all the voluntary actions are affected. So that's just the breakdown of this condition. Looking at diagnosis, so genetic testing is done to confirm the presence of mutations in this particular survival motor neuron 1 gene. Then there's something called electromyography and nerve conduction study, which is done to assess the muscle and the nerve function. Then muscle biopsy too is done to rule out other neuromuscular disorders. Then magnetic resonance imaging, that is MRI imaging of the spinal cord, is done to evaluate the extent of the nerve damage. Then, like I always talk about, differential diagnosis, that is other conditions that could mirror the same signs and symptoms as this condition. The first one is muscular dystrophy, like we discussed before. So they can have they can have the same they basically have the same signs and symptoms, and then they basically have the same signs and symptoms. The only difference is that muscular dystrophy is not a neuromuscular disorder compared to spinal muscular atrophy. So that is the major difference. It's not a neuromuscular disorder. Then we have congenital myopathies too. Then motor neuron disease such as amyotrophic lateral sclerosis. Then some metabolic disorders affecting the nervous system too can mirror the same signs and symptoms as this spinal muscular atrophy. So looking at the approach considerations or the ways we can manage this condition, for the medical treatment, we could do gene therapy to replace the faulty gene. So if we do gene therapy, replace this faulty gene, this gene will be able to produce these proteins. This protein will be able to help, will be able to be used by the motor neurons and then send the signals. So gene therapy can be a way to manage this condition. Then there's a particular drug that increases the production of this survival motor neuron protein, and is known as nusinersen. So this particular drug can be given to increase the production of this protein that the motor neurons need to perform their function. Then we can also do physical therapy, exercises to maintain mobility and reduce the joint stiffness. And we could use assistive devices like wheelchairs, braces, and other things to support movement. Then, like I said, for when respiratory complications are involved, we could give non-invasive ventilation to assist with breathing. Then suction devices to clear the airway secretions. Then nutritional support, people that cannot swallow because of this defect, we can do feeding therapy, like using feeding tubes. And then we can do there's something called gastrostomy tube placement, which is done in severe cases to provide adequate nutrition. So severe forms such as spinal muscular atrophy type 1 have a poor prognosis if left untreated, because if left untreated, most infants, they can't make it past 2 years of age. They have a very slim survival rate. But when it comes to milder forms like spinal muscular atrophy type 3 and type 4, they usually allow a near to normal lifespan with physical limitations. So early treatment significantly improves outcomes, and supportive care and also recent advancements in gene therapy have been able to increase life expectancy. So that's basically the breakdown of spinal muscular atrophy. Thank you.